To begin, we have our cranial bones. We have our frontal bone here, our parietal here, our occipital located here. Our external occipital protuberance is located here. It is for it is where the muscles keep the head upright and allow the head to tilt backward attach. And lastly, we have our temporal located here. Starting with our external view, we have our temporal mandibular joint located here. Next, we have our mastoid process located here. Our styloid process is located in here. Our external acoustic meatus is located here. And our squamous part is located here. Moving on, we have the petrous part of the temporal bone, which is located here. This structure houses the interior components of the inner ear. Next, we have the internal acoustic meatus, which is located here. And what passes through this opening is the internal auditory meatus, provides a passage through which the vestibulocochlear nerve, the facial nerve, and the artery of the branch of the basilar artery can pass from inside of the skull to structures of the inner ear and face. Next, we have our sphenoid, which is located here. The external view and the greater wing would be located here. Next, we have our superior orbital fissure, which is located in here. What passes through this opening is the lacrimal nerve, the frontal nerve, the superior ophthalmic vein, the trochlear nerve, the superior division and inferior division of the oculomotor nerve, and the abundance nerve. Our internal view consists of our lesser wing, which is located here, our greater wing, which is located here, our optical canal, which is located here. What passes through this opening is the optic nerve and the ophthalmic artery, and our sella tertia, which is located here. The structures that sit in this fossa are the pituitary gland. Our ethmoid bone is located here. Our ethmoid bone consists of the crista galli, which is located here. Kind of comes out. What this does is where the falx cerebri attaches anteriorly to the skull. Our cribriform plate surrounds it here and here. What passes through this hole are the olfactory nerves passed from small receptors in the nose to the brain. Moving on, we have our sutures. Our coronal suture is located here. It is made up of the parietal and frontal bones. Our sagittal suture is located here. It is made up of the two parietal bones. Our lambdoid suture is located here. It is made up of the parietal and occipital bones. And lastly, our squamous is located here. It is made up of the temporal squama with the lower border of the parietal bone. Next, we have our facial bones. Our maxilla and alveolar process are located here. Our nasal bone is located here. Our zygomatic is located here. The zygomatic is made up of the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. We have our ethmoid here. We have our vomer located here. The bony part of the septum is made up of the perpendicular plate of the ethmoid bone, vomer bone, and the maxilla bone. The inferior nasal concha is located in here. As the air passes through the turbinates, the air is churned against the mucosa-lined bone in order to receive warm moisture and cleaning. That is what this bone. We have our mandible, which is located here. The angle of our mandible is located here. The ramus of our mandible is located here. The mandibular condyle is located here. The mandibular notch is located here. And the coronoid process is located here. The vertebral column has 4 curves. Our first curve is here, our cervical curve. We move on to our thoracic curve, and then our lumbar curve, and lastly our sacral curve. The thoracic and sacral are primary, and the cervical and lumbar are secondary. Our cervical vertebrae is the first 7, which would be here. Our atlas would be our first one here. This articulates with round condyles on the underside of the skull, the occipital bone, and allows for neck flexion, as I demonstrate here. The transverse process of cervical vertebrae are unique because they have holes in them called transverse foramina. Vertebral arteries come out from the neck through these holes before entering the base of the skull to supply blood to part of the brain. There are 12 thoracic vertebrae. The spinous process is this. Our transverse process would be here. Our intervertebral foramen would be here. What passes through these foramen is the root of each spinal nerve, dorsal root ganglion, the spinal artery of the segmental artery, communicating veins between the internal and external plexus, the recurrent meningeal nerves, and transforaminal ligaments. The body of our centrum would be this. And the position of the intervertebral disc would be upright. Our sternum is located here. The manubrium of our sternum is here. The body of our sternum is here. The xiphoid of our sternum is here. And the jugular notch is here. Lastly, we have our ribs. Our vertebral sternal are our first 7. 1, 2, 3, 4, 5, 6, 7. Our vertebral condyle are the next 3. Our floating ribs or vertebral ribs would be these 2. The head of our rib would be located here. The neck of our rib would be located here. And the tubercle of our rib would be located here. All 12 ribs articulate posteriorly with the vertebrae at the spine. Each rib forms 2 joints, our costal transverse joint and our costal vertebral joint. The head of the rib fits into small depressions located on the sternum of the adjacent vertebrae, known as demifacets. The tubercle articulates with costal facet located on the transverse process of the more posterior vertebrae, and the ribs angle posteriorly at point of articulation.